You are watching Eawaz TV, Voice of Community.
Hello, good morning, Ms. Sylvia Jones, Deputy Premier of Ontario. Thank you very much for connecting with us this morning. We are really thankful that you gave us time.
No problem. Good morning to you, Sylvia.
Okay, Ms. Sylvia, there are some very important questions related to the healthcare system in Ontario. So this latest thing that has come up, please give us some details about it, and then we'll take it forward from there.
Well, I'm really excited to announce that we are removing some of the barriers that, in particular, individuals who have trained in healthcare professionals outside of Canada are going to be able to, in a more streamlined, faster way, get into working in healthcare systems. So things like removing the Canadian work experience component, things like accepting language tests that have already been approved under the Immigration and Refugee Protection Act in Canada to reduce that duplicative language proficiency testing. I'm very excited to see that these short-term fixes are going to see more healthcare workers having the opportunity to provide services in Ontario and in our communities.
Oh, that's wonderful news, and we know that for the last several years the Ford government has been doing very good work, especially during the pandemic period. But of course now you are feeling the crunch, especially in the healthcare system. Have you been able to talk to some of the governments, in Asia, for example, like Pakistan? You must have heard it faced a devastating flood, but still they don't have any shortage of doctors or nurses or medicines that we see here. So have you been talking even to any of the governments, like Pakistan?
So what we have seen is the health human resources shortages seem to be experiencing in certainly all across Canada and in North America. But what we're focusing on right now is individuals who are living in Ontario who want to practice in the health system. We're going to remove some of those barriers so that they can more quickly be included in our system particularly.
That's fantastic, because you might have heard that some of the most, skilled doctors are driving taxis. They have become cabbies. So that's a very good step. Okay, this is one thing. Second thing is that once they are brought in the realm, still will they be required to take the exams, or even that barrier has been removed? Because some of them are very, very experienced.
Yeah, it's a really good point. So one of the changes that we're working with the Regulatory College on is, again, removing that need for Canadian work experience. What we were finding was individuals who are highly skilled and coming from other communities but want to practice in Ontario had a barrier because they could show lots of work experience but none in Canada. So by removing that, that really will speed up the process for those individuals to work in our hospitals, long-term care, and community.
Yeah, that's great. But my question was that will they be taking the exam, the Canada medical exams?
So there is a process through the College of Physicians and Surgeons of Ontario. We ensure that they have the equivalency test, we call it.
Okay, yes, that's right.
Work experience equivalency. And in some cases, it may just mean a small upgrade where they need to have a little bit of education on perhaps how the data system works in a particular hospital. So when there are specific needs that are exclusive to a particular hospital or Ontario, those upgrades can happen faster.
Okay, that's great. And some of the parents, they have been complaining about shortage of meds. So is the Ontario government talking to the federal government, or is it talking on its own to some of the foreign pharmaceutical companies, or is it saying that, we will give some incentives to our own local pharmaceuticals so that they speed up provision of meds? Anything in that stream going on?
Yes, absolutely. I've spoken numerous times to the federal minister, and because we know that we are seeing some shortages on the shelves, particularly as it relates to children's acetaminophen pain medication. I've been assured that has been resolved, and there is a substantial supply that is coming in this week. But it is greatly concerning that it has taken a number of weeks for them to, the federal government, to actually find a solution.
But the federal government announced that starting this week, the meds are going to be on the shelves. So do you have this news?
Yes. So as recently as this weekend, I was in conversations with the federal minister. It is my understanding that a large chunk of those children's pain medication will be going to hospitals first, but there is a solution that they have worked on. I frankly wish that it had been dealt with sooner, but I'm pleased that we're moving forward.
The COVID once again is spreading in Canada. So you, as the Deputy Premier, is your cabinet, are you sitting with the Premier and are you discussing bringing back the restrictions once again? Oh no!
So I think it's really important to reinforce that we have so many more tools to protect people than we did when we first discovered COVID in Ontario in 2020. You know, the ability for people to be vaccinated, whether it is for flu shot or for COVID-19 boosters, really gives us a lot more protection. I like to say we didn't know what we didn't know, and now we have protections in place, whether it is for flu influenza virus or COVID-19. And I would encourage people to have those conversations, and if you get protected through getting your flu shot, getting your booster for COVID-19.
Excellent. Thank you very much, Ms. Sylvia. We know that, ma'am, you are very, very busy, and we would have loved to talk to you, for at least for half an hour. But I know you have another meeting. But thank you, nevertheless, for connecting with us and talking to us and giving this brilliant information to our listeners. Thank you.
You stay well.
You too. Bye-bye.
You are watching Eawaz TV, Voice of Community.